please introduce yourself.
Okay, my name is Maria Hamlin Zuniga. I was born in the United States and I came to Central America 52 years ago. And I've lived in Central America ever since that time. I came here to work on training community health workers in primary health care in mostly indigenous communities. Over the years, I've been active in developing organizations and networks. We have a network in Central America that was founded before Alma Ata. It was founded in 1975 with community health workers throughout Mesoamerica. And so when Alma Ata defined primary health care as a strategy for governments, we had already been working that way since the late 60s. Really? And we were so pleased with learning about governments wanting to be involved in primary health care, but that didn't last for long. They thought that that was too revolutionary, and they went back to their more specialized primary health care, selected primary health care. Our network was one of the groups that was involved in setting up the International People's Health Council in 1990, and then later on being on the organizing committee for the first People's Health Assembly in Bangladesh in the year 2000. We actually worked for 2.5 years organizing the first People's Health Movement. A lot of preparatory work was done throughout the world. The group that was organizing the assembly developed educational materials for people to work on in their different countries before they came to Bangladesh, so that people would be prepared to talk about why there was not health for all by the year 2000. Yeah. So the People's Health Movement was founded on the basis of really restoring that ideal of health for all and recognizing all the ways that health for all was being undermined by what governments were doing in terms of healthcare or lack of healthcare for the people. Healthcare was not seen by most nations or peoples to be a fundamental human right, like we said in the Declaration of Bangladesh in the year 2000.
I wasn't there. Do you remember? Okay, you are a founder of PHM, of the People's Health Movement. Why did you start with it? And you started with Mira Shiva and with the Frolla. Who else? David Saunders?
Oh, there was a fine group of people from around the world, actually. There were people from Malaysia, from India, from Bangladesh, of course, Safrula offering to have the first People's Health Assembly in GK, which is exactly a perfect place to do it because it was one of the finest examples of integrated, comprehensive primary health care. And there were people from other countries around the world on the organizing committee. As I said, we worked for many months before we had the assembly. And so the people who were in the network that I was involved in, the International People's Health Council, had point persons around the world, in Africa, in Asia, in Latin America. And so we were one of the 8 groups that helped to set up the People's Health Assembly, the first People's Health Assembly. Why did we do it? Well, we felt that the voices of the people must be heard because the People's Health Assembly was an assembly of community organizations and primary health care programs, people's programs. It wasn't an assembly of ministers of health from governments from around the world, like the World Health Assembly is. The World Health Assembly is not the voice of the people. It's the voice of those politicians that happen to be in power in the ministries of health at that present time. And there have been some remarkable people in the WHO, like Halfdan Mahler, our dear comrade. And then there are other people who have not been friendly to people's health and people's movements. So it was important for us to have a place where we could hear the voices of the people. That was our theme, to hear the voices of the unheard. And I think we really achieved that with our delegations from around the world. And that's why we set out the declaration in Bangladesh. And it took us actually a whole year to decide to start the People's Health Movement on the basis of that manifesto, that declaration. And so we started working on ways that we could promote the People's Health Movement through the people who had been at the assembly and the people who were their constituencies back in their home countries and communities. So that's how we started, with very high ideals and hopes for a future where one day we could have health for all.
And do you think it will come?
Well, if we don't change this world, we're not going to have health for all ever, because we live in what we are calling in Latin America a crisis of civilization, where the dominant model of capitalism is destroying our world. And if we don't come to a realization of that crisis and do something about it radically, we are never going to have health for anybody. Yeah. And I think that one of the best examples is what is happening to us right now, today. We have a worldwide health crisis, and we have major governments around the world who simply negate that this exists, that it's a hoax, that this is just another flu and that people are going to get it and get well. Now, some people will get it and get well, but other people will die. And the people who will become sick and die are the people who live in poverty, who are minority populations in majority white populations, such as in the United States, indigenous people who will die massively in Brazil because of the crisis of the virus entering into their isolated communities and decimating them, just as disease has done before for indigenous people in other countries of the world. The other part of the crisis of our civilization is the whole issue of climate change. And right now, in the United States, where I don't live, but in the United States where I have family and friends, the whole western coast of the United States is burning up with terrible forest fires that they're unable to contain. Many millions of acres of forest have been burned down. Communities have been destroyed, and people are dying. And people are suffering not only the consequences of the fire, but the smoke and the pollution that that's creating. At the same time this fire is going on the west coast of the United States, another devastating hurricane is heading for the same area that was devastated just a few weeks ago. In the next few hours, a hurricane will enter into Louisiana, into Mississippi, and into part of Florida. Why are these hurricanes hitting in the northern hemisphere? When I first came to Nicaragua, hurricanes hit us. We were directly in the western path of hurricanes that developed on the west coast of Africa. Today, those hurricanes, those tropical storms develop, and they immediately move up into the Atlantic, into the northern Atlantic, They go into the Gulf of Mexico where there are extremely high temperatures in the ocean, and that's what causes the hurricanes to form, the storms to build up to hurricane measures because of climate change. And as long as we do not drastically do something about climate change, we are destroying the planet as we know it today. So we believe that this crisis of civilization is the result of a capitalist model that's extractive and that doesn't respect nature and doesn't recognize that human beings are an integral part of nature. Instead of being dominant over nature, we are part of nature. And the indigenous people that I work with and in Latin America as a whole, within their cosmovision, understand this, that we are part of nature, and that if we don't have equilibrium with all the different aspects of nature, then we are going to destroy it. And so I'm not very optimistic that there will be a dramatic change. Some of us felt that perhaps an analysis of what's happening of coronavirus would help lead people to different conclusions. We know that this is happening in different areas. We have frequent webinars where we discuss what people are doing on the local level. But until there is some planetary decisions made, until there's global governance that will work toward limiting climate change, I fear that we are destroying our planet.
At the moment,
I hate to say that.
but we have a lot of young people in Fridays for Future who really do a lot to save our
Yes.
planet. And I
Yes.
think
Yes.
your point is it is very, very crucial for health. It is the part we didn't see so much in the year 2000, but we have to see it today. Climate change is the most important part of health.
In the Bangladesh declaration, we talked about environment, and we talked about influences on the environment. But of course, we didn't have the continual crises. In the year 2000, the hurricanes were still arriving here in Central America. Now the hurricanes go to the north and are destroying so much in the north. I too believe in the power of youth. And I really pray that more and more youth will become involved. It's so inspiring to me to see people like Gerta, the Swedish young woman, and the other people who are in the different movements around the world that are trying to deal with this. But they have to see the connection between the overconsumption of capitalism and climate change. And until we make that connection, and some people are afraid to make that connection.
Exactly. You're talking about Latin America or Mesoamerica. You also founded the PHM in Latin America. So
Yes.
what do you see there exactly at the contribution of it?
In the year 2000, we said we would someday like to have another People's Health Assembly. So for several years, we planned to have an assembly, and we decided to have it in Latin America. The second assembly was held in Cuenca in Ecuador. Ecuador is a country on the equator. It's a country that is largely indigenous people. And our second People's Health Assembly was really based on listening to the voices of the people in our communities. We wanted to listen to the voices of the unheard in the first People's Health Assembly. And so in the second People's Health Assembly, we wanted to listen to the voice of those nations that are often unheard, like the indigenous people and the African American peoples on our continent, and also people who are indigenous on other continents. So we started our second People's Health Assembly with a beautiful ceremony that involved people who were shaman or curers or sacred and people who are regarded in a sacred way in their different communities, who are trying to heal their communities on the basis of bringing equilibrium to our communities. And so after the second People's Health Assembly, because we had so many people who came from Latin America, we decided to really help to develop the People's Health movement in Latin America. Now, it's not easy because the People's Health movement has been largely an English-speaking movement. And in Latin America, we speak Spanish and Portuguese. And we can't expect everybody to speak English because they simply don't have that opportunity. To be able to speak English, it means that you're in the middle or higher classes who have that opportunity. And so we felt we must develop the movement. And in Latin America, we had a whole history of community-based health work. Like I said, we started in Mesoamerica, in Guatemala, Mexico, Nicaragua, Salvador. We started in the late 80s working with people's with people's health through community health workers. That was also true in South America. There were many different groups, mostly groups that were related to liberation theology and to the option of many religious people in the Catholic Church, their option to work with the poor. And the way many of them did it was through their work with the Pastoral de Salud, working with health as their main way of working with communities. And because of their involvement with the poor is the reason why many of them became involved in one way or other in struggles for liberation and transformation of these communities. And that's why we saw in the 70s and 80s many religious workers and people who were involved in pastoral work, whether it was with the Catholic Church or the Lutheran Church, Methodist, all those mainstream Protestant churches, they lost many people through assassination. Their health workers were assassinated. Their people who were working on literacy training were also assassinated. And so people became more radicalized, and that's why you found people becoming involved in the revolutionary movement, for example, here in Central America. And many of the people who were involved were people who were faith-based people. And because of that, people in other places around the world became convinced of our struggle. Germany had a very strong relationship with us in Central America. German organizations, German people, Bread for the World, Médico Internacional, Miserior, and others were really essential to the kind of work that we did in community-based health care here in Central America and other parts of Latin America. So we have a strong primary health care and popular education orientation to the work we do. So it was easy for us to work with that militancy that existed to involve them into the people's health movement in Latin America.
How many people has the PHM Latin America?
We have people who are involved within their own organizations in about 19 countries of Latin America, and 14 countries are very, very active. They don't always call themselves People's Health Movement, but they identify as the People's Health Movement. Like here in Central America, we are involved in the regional committee that we started in 1975. That is the Mesoamerican chapter of the People's Health Movement. In Argentina, for example, there's a movement called La Crimpo. La Crimpo started 30 years ago with people from religious communities and the communities in which they work in their pastoral, in their health pastoral work. And so they became involved in the People's Health Movement quite early on. Marcelo Lobato was in the People's Health Movement, was one of the founders of that particular movement. They're strong today. They work a lot on food sovereignty and saving seeds. They're very active on saving seeds and working on nutrition based on community gardens and saving the natural seeds and not the seeds that come from the big companies. They also work on a lot of traditional medicine, the use of medicinal plants. And as in Argentina, excuse me, there are also groups in other parts of Latin America that are especially concerned with environmental factors and its relationship to health.
You mentioned the human right to the highest attainable health state. You mentioned health for all and the really important document of Alma Ata. Can you say some words about this?
Well, the Alma Ata Declaration, for many of us, is the first major mandate that we have to work on primary health care. For those of us that have been doing that kind of work in communities, it was such a wonderful moment when we first read the Declaration of Alma Ata, and it became our teaching tool, and it continues to be our teaching tool. We have had a number of international people's health courses in Latin America. In El Salvador, during the government of the FMLN, we had 8 different courses for activists from Salvador, from health personnel in the Ministry of Health, and with participation of people from other countries in Central America. And we always use as our first document for people coming into the course the Declaration of Alma Ata, because it states so clearly what we believe should be. And we also use the vision of the People's Health Movement, because the vision of the People's Health Movement is just a broader way of expressing what is our belief of the fundamental right to health in a holistic way. No, it takes in other aspects that are the social determinants of health. So we work with that document as the basis. And every course or activity that I'm involved in when I'm talking about comprehensive primary health care, I start with that document because I think it is so important for us as the People's Health Movement.
Okay. I think you covered most things, but do you have to say anything else to the German-speaking world?
Yes, I would like to say that as somebody who has worked as a health activist all of my life, I am not discouraged so that I would abandon my militancy for health for all. I know it's difficult. I know we have great challenges, but what I want to do is through the examples of of myself and my contemporaries that founded the People's Health Movement, people like David Warner, like Mira Shiva, like Safrullah, like David Warner. I want people to carry on. And even though times are difficult, know that every step of the way has been a challenge for all of us. And there are times when we want to give up and say no. But now we have the whole world the planet that we have to think of, not just the health of the people, the health of the planet. And so I want to inspire them to go forward, to continue in this struggle for health for all.
So, thank you for this great interview.